So this is Dr. Bartu Wilson with another episode of Pilltalkpodcast, giving you your daily dose of medicine to educate, motivate, and inspire you to live at your full potential. I have a great guest on today, Dr. Scott Kincaid from Presbyterian School of Pharmacy. He's going to let us know a little bit about what he does there and how he's impacting the students' lives. And
Scott Kincaid, I'm the Assistant Dean of Student Affairs at Presbyterian College School of Pharmacy. I'm located in Clinton, South Carolina, and I'm really excited about sharing my journey with you.
Nice. We're just ready and excited to get this conversation started. How you doing today, Dr. Kincaid?
I'm doing well. It's a beautiful day here in Clinton.
Always. I remember those days down there. I don't think it ever rained. No, I was messing with you. But, all right, so we're going to get to know you a little bit and then you're going to talk a little bit about your career path and where you're at now. From your resume, your background, seemed like you did a lot of great things. You touched a lot of different schools and was able to impact a lot of people. So before we get into everything, let's start with you. How did you get your spark to become a pharmacist or get into the pharmacy field?
So that started for me really in middle school. I was one of those kids that I always had some drive to be something bigger. And I feel like I went through several different, options. I started off thinking that I was going to be a marine biologist, and I wanted to stay in West Virginia and thought, oh, well, there's no ocean, close to West Virginia. So I'm going to have to rethink that one. And I then, navigated sort of to medicine and thought, hey, I'd love to be a surgeon. I have a benign familial tremor. So like as somebody who shakes all the time, not a good thing for them to be holding a scalpel. So I was trying to find really like where I was going to land. And I had an instance where I was talking to one of my teachers, and they asked me like what I wanted to do. And I wasn't quite sure what that next thing was going to be. I knew that it wasn't going to be a physician or a marine biologist. And one day, one of my teachers, I commonly had medications with me, like, Tylenol or ibuprofen. And one of my teachers actually said, hey, could I get some ibuprofen? I was like, yeah, sure, absolutely. This was back in the day when students were allowed to have medications at school. And I was like, yeah, sure. Just make sure you eat something with that. That'll tear up your stomach. And they giggled and said, Kincaid, you should be a pharmacist. And I went, interesting. And then that sort of started the thought. And I went down that road. I started thinking about how it would fit me as a person, and I would be able to help people because I love helping people. And it would also give me that opportunity to do something that was bigger and greater than me. So
Nice. That's full circle how that just came along. But basically, you did your first consultation with a patient, and that led you down your path to become a pharmacist.
Yep, exactly.
So they sparked that idea, like, why would you should become a pharmacist? So you just decided from that point you want to become one. So what was the education? Did you do a 4-4 program when you went to pharmacy school?
I did a 2-4. So I was at West Virginia University. I did 2 years undergrad, 4 years pharmacy school at West Virginia University School of Pharmacy. Go Mountaineers. And I had a wonderful time there. The faculty that taught me truly inspired me and really helped me become who I am today. One of my faculty members there, Doug Slane, he actually ended up being my mentor because I went on to do a PGY1 at WVU hospitals and then on to do PGY2 infectious diseases at WVU hospitals under Doug as well. So it was a great opportunity for me and something that really set me on the right path for my career.
All right, great. So just for anyone not knowing what it is, so a PGY1 is a pharmacy residency year 1, and a PGY2 is a pharmacy residency year 2. For the people that's listening, can you break down just the intro of a PGY1, and then let's talk about your PGY2, because that was kind of led you or made you into the career that you have now with being an infectious disease specialist and educator.
Yeah, sure. So the PGY1, so actually back whenever I did it, they weren't called PGY1s. They were called Pharmacy Practice Residencies. And the Pharmacy Practice Residency was really built to expose you to as many different things as it can on the inpatient side of the hospital. So we were in the hospital working alongside the physicians and nurses and respiratory therapists and physical therapists and all those individuals day in and day out. And, they were long hours. They call it residency because you basically live there. And so it was a lot of time. It was a lot of work, but a lot of learning. And the folks that I had the pleasure of training under at West Virginia University, they were just amazing. And I still to this day take things and use things that they taught me back, I guess 16 years ago. So
nice. So let's talk about your PGY2, because that's what a lot of people want to know and understand, because you went into that year focusing on infectious diseases. So can you break it down about that residency program? Yeah,
of course. So it was interesting. Whenever I actually, jumping back to pharmacy school a little bit, I didn't know what I really wanted to do other than I wanted to be a pharmacist. And I started off thinking that I was going to be a retail pharmacist. And as I got more accustomed to like what the opportunities were for pharmacists in the inpatient realm, that's when I decided to do a PGY1. And then whenever I got in my PGY1, I was actually doing some teaching and like helping with labs and some things that were more focused on infectious diseases. And Doug, he pulled me aside one day and he said, "Hey, you seem to have a knack for ID. Have you ever thought about doing a PGY2?" And I was like, well, my original plan was I was just going to go and be a clinical pharmacist somewhere. I wasn't, necessarily going to specialize, but I do like infectious diseases a lot. So, I would be interested in that. And he said, well, you need to sleep on it, think on it overnight and get back to me tomorrow and let me know, is this something you truly want? And I said, okay, I'll get back to you. And overnight, I just thought about it. And the more that I thought about it, I was like, man, that really would be great. I would love to do that. And one of the things that Doug said to me at that point, he said, you have to understand, like right now is the time for you to do this training and to get it taken care of. And that will be with you for the rest of your life, for the rest of your career. And I was like, man, that's a really good point. And there's really no better time to do it than now. So I slept on it overnight. I came back and, I told Doug, I was like, yep, I'm in. I'm interested. He said, are you sure? And I said, no, I'm 100%. I absolutely want to do it. And he said, okay. So he early committed me to the residency, and I was thrilled to be, planning to do that. So that next year I spent a lot of time, about 6 months of the year, I was on the infectious disease consult service, and I got to work with some awesome physicians, Rashida Kaku and Arif Sawari. They were the ID attendings that were like the main ones. And then Melanie Fisher was also there. And Melanie was actually, she was one of the ones that got me linked into travel medicine. And I did my first mission trip with the School of Medicine. And actually, it was because of Dr. Fisher. I was working with her in the HIV clinic there at WVU, and they were talking about this mission trip that was going to be happening. And I was like, oh man, that would be cool. Does the pharmacist go? And they're like, we've never had a pharmacist, but we would love to have a pharmacist. And I was like, sign me up. I totally want to go. So I had had the responsibility of figuring out where the money was coming from, obviously. And the dean of the School of Pharmacy was awesome. He pitched in some money for me, and Doug was very accommodating. He was like, yeah, if you can get everything set up, I think it would be great. So I ended up spending, 24 days down in San Lucas Tolaman, Guatemala, and basically was in the middle of nowhere, Guatemala. I spoke some Spanish. I had Spanish as classes, but I was not fluent at all. And being dropped right in the middle, it was just an amazing experience. You get to see infectious diseases there that are so much more exacerbated or serious or severe than what you do everywhere else. So, it was very cool. It was a very good learning experience. I've continued that, those mission trips throughout my career, and have been doing them for, I guess 14 years now. So something that was very impactful. But the infectious disease residency really put me into that spot where I was able to find my niche within the profession and be able to do those things that really gave me passion and satisfaction and helped me to center myself. Every year that I would go, it would sort of bring me back to, to center, so that I knew where I was going and what I was doing and why I was doing everything that I was doing as well.
Okay. Great. We definitely going to talk a little bit more about the mission trips a little later in this podcast. But for infectious disease, so you did the residency. It was a year-long residency. You had your mentor, Dr. Doug. Is that correct?
Doug Slane. Yeah.
Dr. Doug Slane. And he kind of guided you through this because he saw that you have a knack for infectious diseases, and that was your niche to getting into the pharmacy field.
Right.
So with that education of infectious disease, what was your next step? Did you jump into the hospital realm, or did you get into education to teach infectious disease?
Sure. So it was both. So I became a faculty member at South University School of Pharmacy in Savannah, Georgia. And I had a practice site at St. Joseph's Candler Health System right there in Savannah. And I was focused mainly at Candler. So I spent a lot of time at Candler Hospital. And I had the pleasure of working alongside Janine Gibson. We hired Janine on as the infectious disease specialist for the health system. That she was focused over at the St. Joseph's Hospital, and I was over at Candler. I wasn't employed by the hospital, but Janine was. She was like their official person, but I was working alongside her. I did the stuff over at Candler. We ended up collaborating with Jason Lynn, who is the infectious disease pharmacist at Memorial Health right there in Savannah. And we set up a citywide antimicrobial management program that's still up and running today. It looped in all of the private practice infectious disease physicians there in Savannah that were privileged at Memorial and at the St. Joseph Candler site. And we all worked collaboratively to try to improve the antimicrobial resistance within the community and to just use antimicrobials more appropriately. So I did that. That was one of the things that I was very involved with from a practice standpoint. And then obviously, I taught a lot of courses, including infectious diseases, medical Spanish, advanced ID seminar, a variety of other courses there at South University. But I spent a lot of time over at Candler. I actually did moonlighting there as well. So I would after my day was over as a faculty member, I would actually stay on and staff the evening shifts over there and work with some just amazing pharmacists and amazing people over there as well.
Man. So working with Candler and the infectious diseases down there at South University in Savannah, what are some cases that you've probably ran into that you were able to help out or fix?
Yeah, sure. I don't know about necessarily fix, but maybe improve. Obviously there's, with infectious diseases, there's a lot of opportunity to narrow antimicrobial spectrum for the coverage that you're using. and to try to prevent further resistance. We had a number of patients that were quite sick that, either some made it, some didn't. You try to do your best to improve the situation. You obviously want to try to make the biggest impact on the patient and help them to either heal or, have a complete cure from their infectious disease. But sometimes, it doesn't happen, unfortunately, and you have to deal with that. But there were a lot of situations where, we were able to actually de-escalate patients safely from their antimicrobials and have a better impact on their long-term, from lower rates of resistance and also potentially less super infections that may occur, C. diff, trying to reduce those rates and those kind of things. I have a variety of different individual situations that occurred over the years where I had physicians that would call me who I had made relationships with. One in particular, Giff Lorenz. I remember one Sunday morning he called me asking about one of its patients in the critical care unit that had an infectious disease that just wasn't responding, and there was an intermediate strain of organism that was being treated that we needed to make a change and switch over. This was one of those situations where it was unfortunately probably a little too late, but the patient at least was able to make it a little longer until there was family that could come and say their goodbyes. But those type of things, I feel like, we all too often are focused on, just trying to fix everything and not necessarily focused on making sure the families have what they need and that, things are going in the right direction. I think as a profession, we do an okay job at it of like bringing families in. And I think throughout the years that I've been in healthcare, it's gradually gotten better, especially in those times where patients are declining, making sure that the family has those moments to spend with their family and has that closure. And that's something that has been a struggle, obviously, with COVID and having patients who haven't been able to actually physically see their family members. A lot of them do it via FaceTime and those things. But
yeah, I mentioned COVID.
Yeah,
I got a quick question on that. Was you able to do some research and some looking into COVID? I know a lot of people probably got questions. If you got a quick 1-2 response about COVID or people making sure that they get the vaccine, are you able to enlighten us on that at the moment?
Yeah, absolutely. So it's been a very interesting time going through all of what has been the pandemic. The thing that I've found to be very disheartening is there's a lot of misinformation out there about the vaccines, and it's been politicized to a point that is really just unnecessary and unhealthy. Folks really need to understand that the vaccines are safe. And when you think about the things that can happen from vaccines in comparison to what we know can happen with COVID, COVID is so much worse. Any side effects that you might have from the vaccine is going to be very short-lived and in the large, vast majority of times very mild and not severe. So, protecting those around you, protecting yourself even, you need to get the vaccine. It is the way that we can help get out of this pandemic. And the more people that get it, the better off we are as a society from a protection standpoint. And anytime that, folks hear about new technology, they're always skeptical, whether it's a phone or a computer or TVs or whatever. And this is a new type of vaccine, but it's being worked on for decades. The type of vaccine that is the mRNA vaccines. So really, folks need to make sure that they have all the information and the right information, not misinformation that's out there, before they make their decision. And to do the right thing, especially, if you're a healthcare provider, we have a higher responsibility in society to do the right thing and to protect our patients. And part of that is getting vaccinated ourselves.
Thank you. I'm glad you was able to give some light onto that. Being an infectious disease educator and a teacher, whatever, so people can understand that, okay, they're hearing this from someone that's actually in this field and does this on a daily, that the benefits of the vaccine and how it can help you, your family, and society get back to the normal life that we've been used to living before 2020. I think we've been in this. It seems like we've been in this like 2 to 3 years, but
a long time, yeah. Indeed.
Hopefully we can get out of the pandemic sometime soon.
That's right.
All right. So we talked a little bit about your PGY2, how you got into the infectious disease, you being a professor at South University. Mm-hmm. Now we're going to move a little further and keep going down your career path.
Yep.
See that you taught at a couple other schools, and the other school that you taught at was infectious disease as well. Like you taught that as well.
Mm-hmm. Yeah. So my next step in my career, I moved to Kentucky, Lexington, and actually became the internal medicine pharmacy clinical coordinator for UK Healthcare. And whenever I started there, I was practicing internal medicine, which a lot of people don't realize that infectious diseases is a subspecialty of internal medicine. So there's a lot of infectious diseases within internal medicine practice. So it was nice to be able to sort of branch back out a little bit and broaden my skill set by stepping into that clinical coordinator position. After being there a couple months, they came to me and asked if I would be willing to take on the infectious diseases and internal medicine PGY2s at UK. So I ended up serving as the residency program director for UK Healthcare for internal medicine and infectious diseases for about 4 years, for the years that I was there. Nice. I had several awesome residents that I'm superbly proud of. All of them, they did an amazing job, and they're out doing amazing things in the world right now. And it was an opportunity for me to grow and do more things than what I had been doing and had done. After about a year and a half to 2 years at UK, there was a couple situations that came up where my boss, actually the director of clinical pharmacy services, had to go out on family medical leave and ended up she was diagnosed with cancer and ultimately succumbed to the cancer. And they came to me asking if I would step in as the interim director of clinical pharmacy services. And I obliged. I was happy to do so. At that same time, one of my peers was actually out on FML for the birth of her child. So I was serving as the clinical coordinator for cardiovascular services at the time. And also they had asked me to step in and serve as the clinical coordinator for transplant services because that coordinator had changed positions as well. So I was in a lot of positions there for about 4 or 5 months. And ultimately, they gradually, transitioned back over to the people that had them. And then we hired a new person for the clinical coordinator for transplant services. But then I also transitioned. I interviewed and transitioned full-time to the director of clinical pharmacy services role. And I was in that role for about 3.5 years while at UK. And we were going through a period of great growth. A lot of beds were being added to the hospital. We ended up adding a lot of pharmacists, and I was a part of the Boost program for internal medicine and the Marquee 2 study. to show that medication reconciliation really makes a big impact on outcomes. So we were doing a lot. We were very busy. We were growing. It was a very busy time, but I was also an adjunct faculty at the College of Pharmacy there, and had the pleasure to teach a lot of amazing students and work alongside a lot of just really talented individuals within the College of Pharmacy there, and made some great connections and relationships that I still have today. And it was something that, obviously I will never forget.
Nice. Man, it seemed like you had a lot of hats on.
It was a lot of hats.
How was you able to focus in and make sure that all of those positions that you were holding at the same time were being completed at the highest ability?
Sure. Yeah. So I'll be honest, I don't know how effectively I did that. It was one of those things. I spent a lot of hours. It was a lot of time at the hospital, and just, trying to communicate with people, have time to actually sit down and have meetings with the teams to make sure that they were being heard, that any resources that they needed, I was trying to actually acquire those resources for them. I spent a lot of time talking to people and trying to get information and to help support those teams. At that point, whenever you're the leader of a team, but it's not necessarily your specialty, you have to, revert back to trusting all of those individuals that are the specialists in those areas to let them help guide the things that need to happen. And, obviously, having as much time with them and spending as much time looking into the data and the details surrounding it was part of what I did. So, it was a very busy time. There was a lot of things that had occurred during that time that I had to help with, that were some that were pleasant, some that weren't. And it was just one of those things I had to put the time in. So, my family at the time obviously suffered for those months. Just I wasn't able to spend as much time with them, and that obviously isn't good work-life balance. That's why people hold 5 jobs at the same time. So
yeah, you said one thing that's the sign of a great leader, right? You said you had to step back and let the people that was expertise in their field do their job. But that's the sign of a great leader, is being able to give your team autonomy so that they can do what they need to do, so that you can lead the way. Like, a lot of people try to micromanage, but sitting back and being like, you know what, this is what you're good at, have it. Just let me know what the next steps we need to make sure that the project or whatever we are performing gets done at the highest level.
Exactly. Yep. Absolutely. I completely agree with that. I've one thing that I do not say that I am is a micromanager. I also hate being micromanaged. So, that's definitely something that I agree.
Yes, sir. Yes, sir. So we're going to step into it. All right. You at my old college, Presbyterian College School of Pharmacy. I'm a proud graduate of the class of 2015. Happy to see you there now with all this information, knowledge, and the expertise you got. So how are you enjoying Presbyterian so far?
I love Presbyterian. Honestly, the culture here is just absolutely wonderful. The people that I work with are amazing individuals, and they're all so rooted in God's love that it is absolutely just a wonderful place. It's awesome to actually be able to really incorporate, my spirituality into my work. And I think that's something that I haven't been able to do necessarily as freely as what I can here. And I think that helps a lot with just, my approach and the things that I do. It helps me also just with a balance of, my happiness. So the people outside of the School of Pharmacy are also all very supportive and very good to work with. I think we have a really strong program here. We obviously do a really good job of preparing pharmacists to be out and help patients, have a really high NAPLEX pass rates. We really, we do a lot of good work here, and our program is very effective. So I'm very happy that I was able to join this program and to bring my experience and my approach to it as well.
All right, great. Yeah. Being at Presbyterian, Clinton, South Carolina gives you that family feel. Being like the second class there, it wasn't with so many of us at the school so far, but literally everyone knew everyone's name. We knew each other's name. We knew each other's from. The community, we could literally just walk down the street to like the local restaurants to support the local restaurants and everything. So that's the energy that a lot of campuses don't have. And as you can tell, Presbyterian colleges are actually a pretty good place to be. So we're going to jump into, how did you get to PC? Since you was at Kentucky, what led you to PC? Was it something that, because you're not from South Carolina, so it was just something that you was looking for a change and just wanted to try it out, or?
So after Kentucky, I had actually gone to LECOM School of Pharmacy down at Bradenton, Florida, and I was there for about a year and a half, and it was time for another change for my family. And whenever I left Kentucky, part of the reason that I left was my wife and I had our daughter. She's 3 now. And it was one of those situations where I needed a little bit more work-life balance. I was spending a lot of time at the hospital, and I just, from the time that I would be spending away from her, I wasn't going to be able to be as involved with her life as what I wanted to be. So it was time for a change. That's when we went to Bradenton, and I transitioned down there, had better work-life balance, was able to spend more time with my daughter while she was young. And whenever it was time to change, I started looking. I have a long-term friend who actually is the chair of the Pharmaceutical and Administrative Sciences Department here at Presbyterian College, Dr. Gumina. Dr. Gumina was actually my best man, or one of my best men, in my wedding. Nice. And I met him at South University way back, 2007, 2008. And he had been trying to recruit me since he came here in, I think, 2013. He had been trying to recruit me here, and just things had not lined up quite perfectly. And then this time it was like they had a position, they needed an infectious disease guy, and here I am with an opportunity to move. And it's obviously much closer to home, being from West Virginia. Florida was just way too far from family. So it's time for that move. Interviewed, and here I am.
Hey, glad to have you there. So now you're at Presbyterian College. You're a man of many hats. You like to wear them at the same time. So you are an associate professor of infectious disease and also the assistant dean of student affairs, right?
Yeah, correct.
Okay. So let's jump into your roles and responsibilities as a assistant dean of student affairs. So let's start off, like, what is that position, and how are you, what is that position?
Yeah. So in academia for pharmacy, you have like the academic side that is all the classes, all the things that are very defined and that we teach. Then you have everything else. And the assistant dean of student affairs is like the everything else person. So, whenever it comes to, the professionalization of students and helping students make the transition from, pre-pharmacy into pharmacy, and also from pharmacy program to being a full-fledged pharmacist, and dealing with all of the professional responsibilities and things that you have to be able to do and do well once you're out. That's part of what my responsibilities are. I help with, counseling students whenever they are maybe less than professional and need to be more professional. So helping them grow and identify those areas of opportunity and working through those things with them. I spend a lot of time, helping students. I always say patients, but helping students go through and figure out, what it is that they need to change to be better. And anytime that students have issues, whether it's, something within their personal life, if they have challenges that are facing them, with the process of becoming a professional, becoming a pharmacist, finding a job, figuring out what their career path is, all of that is sort of what I try to do, is try to help them navigate towards what their best career path is going to be and what they most would like to do once they're done with us here at Presbyterian. So I spend a lot of time talking to students and helping them sort of discover themselves.
All right. So what is some of the more common shortcomings you probably would see as students transition from being a undergrad to being a medical professional? And then what are some of the things that you give them tools to help them build on that professionalism?
Yeah. So there's a lot of different parts to that. So I feel like in today's time, there's a huge vulnerability within our students with regard to social media. They tend to, enter the program and they have the same mentality with their social media as what they had prior to being a pharmacy student or working towards more of a professional appearance. And they have to understand that, it's perfectly fine for them to be them, but they have to also realize that whenever they do things as a pharmacy student, especially as a pharmacy student at Presbyterian College, that relationship, it can potentially look bad on the school. It can make them look bad to potential employers going forward. So they need to make sure that if they're using social media, that they're doing it in a good way, that they have privacy settings set so that, if they don't want everybody and their brother seeing all of these things, that those privacy settings are set the right way and that it doesn't leave them potentially vulnerable. I feel like there's also, the general challenge of transitioning to the point of realizing that everything that you do and everything that you say is held to a higher standard whenever you become a pharmacy student and ultimately a pharmacist. And especially if you're talking about things that have to do with health and well-being, those things garner more weight because you are a health professional. And they need to make that transition and start to realize that whenever they're saying things, that it needs to be based on evidence-based medicine and based on the reality, as opposed to just opinion of someone who isn't necessarily trained to make those type of distinctions. So there's a lot of challenges I feel that students go through of figuring out, first off, like how do I actually conduct myself as a professional? How do I make myself look the best to everybody that is around me and also to those future employers? But then also realizing that when you are putting things out there, whether it's social media or whether it's not, you have to think about the things that you're putting out there and how it can be viewed by everyone else in the community and anybody that hears it.
Yeah, I understand that. I'll give you an example, like saying a bad joke, right?
Yep.
So you might find it funny and maybe your circle might find it funny, but if someone's on the outside looking in, they might hear what you're saying and take it as like your true opinion or a fact and be like, oh man, and judge you off of that where that wasn't your intentions. Absolutely. So I see what you're saying, where they need to be more intentional on posting or more intentional on, I won't say hiding, but yeah, I get what you're being more professional.
Yeah.
So we got that part about it, but the second part of the question is, what tools do you give them or what knowledge and information you give them so that they could make these adjustments to come off in the best light possible?
Yeah, of course. So obviously, whenever you find these opportunities, sitting down and having conversations with the students so that they get the full realization about the situation, I think is one of the best ways, because it's more personal to them at that point. It's really difficult, I feel, for people, like if you watch a video or you go through a training module around soft skills, I think we all inherently go, well, that's not me. I get what they're saying, but that's not necessarily me. So having those individual experiences where you have somebody who did something that wasn't perfect, because who does perfect things, and you have that conversation where, you're able to go, hey, like this is one of the ways that could have been viewed. Think about that, maybe you could do it better. There's a lot of like interpersonal communication and interpersonal touch points with this position and those aspects of trying to help have a conversation with the student and guide them down the right path. There are other parts to things that I think, one of the things that I'm pretty passionate about is emotional intelligence, and helping the students improve their emotional intelligence and recognize situations where they weren't necessarily the best self-moderators, or they weren't as self-aware as what they probably should have been and could have been, and helping to sort of point that out, but also even potentially incorporating some of that into our growth and assessment portfolio, helping them to gain a little bit more emotional intelligence, I think is one of the things that I plan to do more as we go forward.
That's great. That's great. So with this position, is there an example that you can give where you came into a situation with a student and you had to have this type of conversation, and then what was the outcome of that, if you don't mind sharing with us, please?
Sure. So there's a lot of little things that you do, the little interactions that you have that help students. The big ones are a lot more entertaining or interesting and impactful, hopefully. One specifically where I had a student who just like what I was saying, had things on social media that weren't the best representation of themselves, and subsequently not the best representation of, Presbyterian, and having that conversation, helping them understand that those things aren't necessarily, what we want put out there, and by that relationship that we have, when you put things out there and you are affiliated with us, it's like us putting it out there as well. So helping them to understand those things, that, whenever you say things, you may not mean it in a bad way, but others may take it in a bad way, and recognizing that that potential risk, not only for us, but for the student as well. We try to, have that conversation. And I feel like those conversations are helpful. The one student in particular, I feel gets it, and has really pivoted and made a good transition to a better direction. Also, having students go through those emotional intelligence courses that are out there that help just from a third party. It's not Dr. Kincaid, telling them for the eighth time something that they've heard 8 times, that kind of a thing. It adds another perspective. And I feel like that also helped in this one particular situation to really give a different perspective and help that student.
Okay. So I got a couple more questions to go. This next question is about to be a real good one. Since you're the man of many hats,
yep.
Work-life balance. How are you able to obtain this now, being an associate professor, assistant dean, father, dealing with COVID? How are you able to kick back and just relax and be able to be your 100% yourself when you're at work and giving your all?
Yeah, so that is a challenge. That's something that I've struggled with my whole career. Work-life balance. It's something where I feel our profession does this to a degree and forces folks into potentially bad situations of work-life balance. We're all so competitive and we want to be the best, and there's only one, the best, but we were all pushing so hard and really driving to the point that we want to make things better. And that's great, but we don't want to push things to the point where the cost of making things better is to the detriment of, our personal happiness, health, our families, those things. So I struggled with this throughout the first part of my career and even, up to, I would say even more recently. Learning how to say no is something that everybody needs to focus on early in their career, and identifying ways to say no, and still, not impair yourself from future opportunities as well. Realizing that, if you say yes and you don't do it well, that may impair you from future opportunities more than just saying no initially. So, I feel like for me now, I have enough of a focus and I'm at least comfortable enough with who I am within the profession that I don't feel like I need to be the best in the public eye. I need to be the best at what I feel is important, and I need to do my job effectively. I feel like my most important job is being a dad to my daughter, and that, number two obviously is what I do here, but I'm not gonna do either of them halfway. I'm gonna do all of the, both jobs 100%. But just being able to make that divide between, whenever I go home, I'm home and I unplug and I do my best to not, creep back into email or any of the things that would be, distracting away from my daughter or my wife. So I think that's something that I've gotten a lot better at over the past couple of years. And especially here, I feel like our dean is an amazing man who supports work-life balance and has that focus that that family is so important. If you're not happy outside of here, and if you don't have, good health outside of here, what you bring into here is not going to be good either. And that's where we all try to focus on helping each other and supporting each other and making sure that we do have good work-life balance.
That's good. That's good. One thing that you said that stuck out to me was the fact that you said, learn how to say no, because if you said yes and do a poor job, that can hinder you from more opportunities in the future than saying no from the beginning. And I had to think about that. Like, you know what? That makes a lot more sense, because if someone looks at you and think that you're going to perform at a high quality, and then you come in and perform not at your best, just to say the least, they will have a different viewpoint of you at that moment, instead of you just saying, no, I can't, or I'm unable to, and then finding another opportunity later in the future. So hopefully someone else catches that as well and learn the power of no.
Yep.
All right. And then my last question, I think this is the question we probably heard our whole lives. What are your next goals? Like, what are your career goals, dreams 5 years from now? Where do you see yourself?
Yeah. So I see myself here at Presbyterian. I feel like this is home. And I want to continue to foster this position and grow it and hopefully make an even bigger impact. I do have some other aspirations that I would like to accomplish. Being able to incorporate some practice into my regular day as well. I have some ideas of things that I could potentially do here at at the school that would be practice associated with the wellness center that we have here and those opportunities. So I do feel like there are some things that I'm going to try to do over the next few years. But I do feel like, Presbyterian is where I'm supposed to be and want to stay here. So next 5 years, definitely here. And, some of those goals really, having re-engagement in my mission work now that the pandemic is to a point where we're able to start going back on those mission trips. I've been going to Guatemala since 2007, and I haven't seen my folks in Guatemala since 2019. So I need to get back there and see my people and do the work the Lord wants me to do. So, those things I want to get re-engaged with and continue to do them well. I think those are some good 5-year goals.
Good. Man, I got one more question because I did say this in the beginning that we're going to come back to the mission trips.
Sure.
So, one, if you can tell us the importance of a mission trip, because I know a lot of people see people do mission trips and kind of think it's one-sided, but it's a two-way street because it's the pleasure of helping others and then others that's being helped, receiving that help. So if you're able to, can you just talk a little bit about that?
Yeah, of course. So, from the time that I started doing mission trips, one of the things that I recognized was my sense of purpose whenever I would return back to the States, especially, would be so enhanced. And I really would find my center and be able to be more effective. We all know burnout and how burnout affects us. One of the things that I feel like my mission trips have done for me is help me to sort of stave off some of that burnout, to really go back and find, a good perspective and to be healthy from a mental state and spiritually as well. Spending that time and getting to see individuals who really don't have access to healthcare. In the States, we have a lot of opportunity for healthcare, and it may or may not be exactly how it should be, but it is tremendously better than other situations in other countries. And being able to have that perspective and recognize, what things you do have, it makes you more grateful for what you do have when you come back. You do have the opportunity to help a lot of individuals who have literally next to nothing, and to be able to provide them healthcare, or even just as simple as providing them vitamins. The grateful look in their eye, the love that they have for you, just for your kindness of going there to help them, is transformative. And it really, I think, especially from a trainee standpoint, I've taken multiple students and residents throughout the years on those mission trips with me, and I feel like it makes a whole different impression on them than what they get in pharmacy school. It adds another element to it, another layer that helps them be a lot more well-rounded and to take a better and more empathetic approach to practice.
Yeah. Man, that's amazing. What is the name of the organization that you go with, just in case somebody wants to look into it?
Yeah, absolutely. So it's Faith in Practice, and you can find them at faithinpractice.org. And they're based in Houston, Texas. Amazing organization. They've been doing work in Guatemala for over 25 years. They started back in the 90s. And I love my folks that I work with. I'm their pharmacy director, so I essentially work with I lead their pharmacy team. I've worked on their village teams, on their surgical teams. I've done a little bit of everything that they do throughout the last 14 years. And now I help with acquiring the medications, setting the formulary, devising the plan for what is going to happen whenever they get out into the village, and how the medication aspect of the, medication delivery aspect of things will happen. We end up, whenever we go down for the pharmacy team, we end up packing, we take bulk size containers and pack it down into patient size containers. And it ends up being somewhere, between like 3 and 5 million tablets that we end up dividing into patient sized containers. So it's a good bit of work. A lot of people, we end up having somewhere between 10 to 15 American volunteers. And then we have a group of Guatemalan volunteers that are typically students, like teenagers that come and help us. And it's just an absolutely fun week. You get to see a whole bunch of people who don't speak Spanish working alongside a whole bunch of people who speak only Spanish, and they're trying to learn, English and Spanish respectively. So it's a lot of fun, and we get a lot of good work done.
All right. So this is a question just for me right here, because you said you're like the director of the faith and practice, the pharmacy director, and creating a formulary and all of this other good stuff. Was it your experience at the hospital that helped you be able to take that role and be able to formulate the formularies and other things like that for the mission trips?
I think it's been all of my pharmacy experience. I started off at CVS, working for CVS whenever I was a teenager, and all through school, and then went and did residency and all that stuff. I feel like it's been just a bunch of the different experiences that I've had. And then obviously the time that I've spent on mission teams, to be able to know like what is the right way. I think we as pharmacists are expected to be problem solvers and to be able to work through workflows and figure out how to best optimize things. And I think that just through the years, that's what my beloved career has given me, is that ability.
Nice. Man, so if anybody want to get in contact with you to either learn about infectious diseases, want to get on one of these mission trips with faith and practice,
yep,
or want to up their professionalism, how can they reach out to you to get in contact with you?
Yeah, of course. So you can reach me via email at sekincaid, KINCAID @presby.edu, and shoot me an email, and I will get back to you as quickly as I can.
All right. So Dr. Kincaid, thank you for being on the episode of Pill Talk Podcast, giving out some knowledge, information, and a daily dose to motivate the people to move forward. I really appreciate you for taking time out your busy schedule, and thank you.
Yeah, thank you for having me. I appreciate it.
This is another episode of Pill Talk Podcast. Until next time.